Hey guys, welcome back to my channel. Today I'm back with another video. I'm going to be doing a day in the life of a medical assistant. Today is actually my last day here working at this dermatology clinic, and so I knew I just had to record a video for you guys. But I'm currently on my way to Dunkin' Donuts to pick up some coffee and 2 dozen donuts for my coworkers, just to thank them for a great working environment. So let's go, guys. So a bit of background of where I've been working. I've been working at this dermatology firm as a medical assistant, and I kind of rotate out with 3 different doctors. And so I'm basically scribing for them. I'm assisting them in surgeries, biopsies. We do cyst removals, we do skin cancer removals, we do cosmetic, we do fillers, Botox, all that kind of stuff. So I've assisted in all of that, and let me tell you, my time here has been absolutely amazing. If any of you guys have an interest in dermatology, I would suggest you go for it, because it's one of the best fields I've worked in, and I've actually come to gain a passion for it. But other than that, yeah, I've basically done all those things, you know, given injections, assisted patients, assisted the doctors, and that kind of stuff. Our day basically starts at around 7:45. We have to be there at 7:45 because they open at 8. So, you know, just to set up the rooms, get everything ready so we can, you know, be ready for the first patient when they come in at 8 a.m. And then we work from about 8 a.m. to 12 p.m. and we have lunch breaks from 12 to 1. Sometimes if we run over, we get a shorter lunch break, but 30 minutes minimum they give us for lunch. And then we come back by 1, and then 1 to 4:30-ish or 5, we see patients again. And kind of in between the day when we're free, we just fill syringes, restock, make sure the rooms are clean, and things like that. So Monday, Tuesday, Thursday, and Friday are usually just regular derm days. We're just doing regular skin checks, we're doing, you know, biopsies, just non-surgical things. And then Wednesdays we usually dedicate to surgeries. So, you know, Tuesday nights we're making the surgery trays, we're stocking them up in the closets, getting ready for the day, for the next day when we have surgeries. Go get the patient, then we'll room them, we'll kind of ask them the chief complaint, ask them why they're here, make sure we have all their medical history. We have these iPads that we use to scribe on. Once we get the chief complaint, we get everything documented. We come out of the room, and when the doctor's ready, we'll kind of tell them, hey, you know, so-and-so is here for, you know, a rash. It started 3 days ago. They've been using hydrocortisone cream or whatever, you know. We kind of tell them what's going on. And then after that, the doctor will kind of go in. We have the little liquid nitrogen spray cans that we bring in as well, in case people have precancers or warts or anything that needs to be frozen off. And then kind of while the doctor is talking to the patient, we're kind of documenting whatever the doctor is saying. So we're scribing for the doctor. Sometimes if the doctor wants to do biopsies or surgeries or minor procedures, we assist with that. We'll set up the trays, the surgical trays. We'll set up the biopsy trays for doing a ED&C, an electrodesiccation and curettage. We'll set up that. And for those of you curious about what kind of questions we ask patients when we room them, usually what we're asking all patients are any past medical conditions like arthritis, asthma, anxiety, depression, diabetes, things like that. We also ask about surgeries, any past surgeries, you know, if they've had hip replacement or if they've had knee replacement, if they've had Mohs surgery for skin cancer, or if they've had non-skin cancers. So anything like that, we note surgeries. And then also we get any known drug allergies. So if they have any allergies to any medications, we write those down. We also ask them if they're currently taking any medications, and we input all of that in. And the reason we put the medications in is because sometimes medications can react, so the doctor doesn't want to prescribe something that can react with the medication they're already on. And then we also ask any family history. So have they had any family history of melanoma, of skin cancers, of arthritis, of asthma, any prominent conditions that run in the family, we ask them about. We also have to ask questions like, do you consume alcohol? And if you do, how much would you say in a day? Would you say less than a drink per day, 1 to 2 drinks per day, 3 or more drinks per day? And then we also ask for smoking status. And the reason we ask for these 2 things is, again, because medications can react with consuming alcohol or smoking. Or, for example, if you have a rash, it could have flared because of an excess alcohol consumption or a reaction to, smoking or any of those things. So we have to ask that as well. And then we just get a pharmacy from them in case we have to send any medications in. But that's really about it. I don't think I'm forgetting anything. Yeah, so that's basically kind of what I've been doing the past couple of months. So I'll just record a couple of clips from today. I can't record everything. I can't record me going in with a patient because that kind of violates HIPAA. So I'm gonna be kind of recording what I can for you guys and then showing you kind of what I do. Alright, hey guys, so I'm currently on my lunch break. I tried to record as much as I could this morning. You know, if I'm being honest, before this job, I never thought I was a surgery type of person. But after this job, I've ended up loving surgery. There's no super invasive surgeries, like we're not, cutting into certain organ systems. We're doing more of the superficial type. And I also have these little letters and I put little like stickers on them because I'm so sad to be leaving, but these letters are for the doctors and nurses and my boss and just a lot of my coworkers that really made a great impact on me, and I'm so sad to be leaving them. And I just wanted to kind of show my gratitude for, just having such a great working environment and making friends that I'm definitely going to want to keep in touch with. So yep, I'll be giving these to them by the end of the day today.